How many seizures define epilepsy? Imagine experiencing a sudden, uncontrolled burst of electrical activity in your brain that causes changes in your consciousness, movements, or sensations. That's a seizure. But how many of these episodes need to happen before doctors say someone has epilepsy? The answer is based on current medical understanding and guidelines. Most often, epilepsy is diagnosed when a person has had at least 2 unprovoked seizures that happen more than 24 hours apart. An unprovoked seizure means it occurs without an immediate cause like a fever, head injury, or illness. This standard is supported by major health organizations such as the World Health Organization, the National Institute of Neurological Disorders and Stroke, and the American Academy of Pediatrics. However, the situation can be more complex. Sometimes, if a person has had just 1 unprovoked seizure but has a high chance, usually over 60%, of having another within the next 10 years, a doctor might diagnose epilepsy. This risk assessment depends on several factors. For example, if an EEG shows abnormal brain activity typical of epilepsy, or if an MRI reveals a structural brain abnormality linked to seizures, a diagnosis might be made after just 1 seizure. It's important to understand that having a single seizure does not automatically mean someone has epilepsy. Many people experience a one-time seizure in their lifetime, but most will not develop recurrent seizures. The key is the likelihood of future seizures based on medical history, test results, and neurological findings. Diagnosing epilepsy involves more than just counting seizures. Doctors will take a detailed history, often including descriptions from witnesses, and may order tests like EEGs to record brain electrical activity. Neuroimaging scans such as MRI or CORT help identify any structural issues in the brain. Blood tests can also be done to rule out metabolic problems or other medical conditions that might trigger seizures. Once epilepsy is diagnosed, the next step is to classify the type of seizures. They are generally divided into focal seizures, which start in one part of the brain, and generalized seizures, which involve both sides of the brain from the beginning. This classification helps guide treatment options and provides insight into prognosis. In summary, epilepsy is usually defined by having 2 or more unprovoked seizures. But in some cases, a single seizure can lead to a diagnosis if there is a high risk of recurrence based on test results and clinical factors. Each case is unique, and diagnosis depends on a combination of medical history, tests, and individual risk factors. If you or someone you know experiences seizures, it is essential to consult a healthcare professional for proper evaluation and management.